We all know that October is Breast Cancer Awareness Month world over, and countries across the world help to increase attention and support for the awareness. This is how we come together to, commemorate World Breast Cancer Month. Now, this, of course, is an awareness on early detection, treatment, as well as palliative care of the disease. The World Health Organization says that about 1.38 million new cases are registered and 458,000 deaths are recorded every year from breast cancer. It is also noted that breast cancer is by far the most common cancer in women worldwide, both in developed and developing countries, in low income, and of course those countries that are already doing well. But we see that the incidence of cancer, breast cancer in particular, is on the rise. Today we sit down to discuss this breast cancer, and of course, being October, it is Breast Cancer Awareness Month. We sit down to discuss today in particular on ways forward. How do we perform as a country in that area? How are we doing? What have we done during this Awareness Month? And the way forward. But most importantly, I need you to know that sitting next to me are doctors and people who have dealt with breast cancer, and they can share lots about breast cancer, what it is, how it is, how you contract it, how you deal with it, who is at risk, all those things we're going to delve into in a bit. I would like to introduce the people seated with me this morning. We have Dr. Mugisha Noleb from the Cancer Institute, and we're glad to have you this very morning. Good morning.
Good morning. Thank you very much.
All right. We also have Ebusu Paul, the ED Cancer Society of Uganda. A very good morning and welcome. Next to him is Dr. Christopher. I don't know if he has become a doctor yet, but I think he's a doctor. Christopher, good morning to you and welcome. All right, and right here is Kagoya Rebecca. She is a cancer survivor, but also a teacher by profession, and she's joining us this very morning. Good morning and welcome. Right, so we go into it, but before we can get into the nitty-gritties of breast cancer, I'm going to ask Christopher Kwizera to give us an overview on exactly what Breast Cancer Awareness Month is, how they are celebrating it, why we should be concerned, and the few things that you and I might not be, party to. Christopher.
Thank you so much, Lynn. Maybe to start with, we do not celebrate the Breast Cancer Awareness Month, but we commemorate the Cancer Awareness Month. Why don't we celebrate? Because, why do we commemorate? It's because we are looking at people who have succumbed, who have died due to cancer, breast cancer in that case, but also create awareness on prevention, including looking at the risk factors and the causes of breast cancer, but also educate people who are struggling with cancer on how to live, on how to seek services, but also on how to continue taking care of themselves. So that's why we call it commemoration of the World Cancer Month. But it's World Cancer Awareness, Breast Cancer Awareness Month. And why do we do this Cancer Awareness Month? It is being set aside globally by the World Health Organization and other cancer prevention players in the world, that we should fight cancer. Like Lynn introduced, breast cancer is the commonest commonest cancer globally, and the second commonest cancer in Uganda. And we know that the Uganda Cancer Institute that deals with cancer in this country sees many people of breast cancer, and most of them come from far in the villages. And I know, as Dr. Michelle will tell us, most of them come when it's a bit late or when they have advanced disease. And majority of them do not even know what are the causes of the cancer. Why did they get the cancer? And of course, looking at the cancer from the side of the non-communicable diseases, we know that cancers, including breast cancer, are the second cause of disease or the second cause of morbidity and mortality among the non-communicable diseases after cardiovascular diseases. So, arriving from the non-communicable diseases side, we look at risk factors to non-communicable diseases. And of course, the commonest risk factors that lead to breast cancer, one of them is the commonest is smoking. And we normally advise people to quit smoking. Number two is physical inactivity. We always ask people to be physically active so that they can beat cancer. Number three is excessive consumption of alcohol, which is one of the risk factors. And we always advise people to cut down on alcohol or else quit alcohol. Then number four is unhealthy diets, the foods that have a lot of cholesterol and a lot of calorific values, including the others that Dr. Noble will tell us. Then also we ask people to do regular and periodic screening so that they can detect the cancers when it is still a bit early, then they can be treated and the people can cure. So today we are here to look at all those issues and other factors, but looking at the breast cancer arriving from the non-communicable disease perspective and looking at the breast cancer as one of the biggest problems that we have as we fight non-communicable diseases. And of course, in the era of COVID-19, also know that people living with breast cancer, as the survivors will tell us, have also struggled, like any other people living with non-communicable diseases, to access services, given the disruptions that have come in access to health services. So today we are discussing this to look at what could be how people living with breast cancer can cope with the disruption of the services, but also how can they manage to ensure that they beat the cancer. And they also, those ones that have not yet developed the cancer, how can they prevent the cancer? And those that are living with the cancer, like I said, how do they treat it? And those who have not developed it yet, how can they keep well? And then we also want to encourage people to continuously do periodic screening. And of course, most people know breast cancer to be common, to be the cancer of women. And I know Dr. Michelle tells us that breast cancer also affects men.
Thank you very much, Christopher Kwizera. Christopher Kwizera works with the Uganda Non-Communicable Diseases Alliance, and he's here with us as well this morning. Now, before we can have Dr. Mugisha Noleb speak about the burden of breast cancer in Uganda, Christopher has highlighted the fact that breast cancer is the second most common type of cancer in Uganda. Now, despite growing efforts to improve awareness and early detection in East Africa, according to the Uganda Women's Cancer Support Organization, a greater 80% of women presenting breast cancer treatment in Uganda have late-stage disease. We want to know, why is that? How come, of course, he's from the Cancer Institute, how come there is a Cancer Institute, but people get to know they have breast cancer when it is too late? So this is why we're going to speak to Dr. Mugisha Noleb. Doctor, you will let us know why. Why is it that when people come to the Cancer Institute or to have cancer treatment, it is too late for them, most of the majority. We see that 80% of women, by the time they show up, they're already really past the manageable stage. What brings about that?
Thank you very much, Lynn. I'm Dr. Noleb Mugisha. I work with Uganda Cancer Institute and I lead the cancer prevention services. We provide cancer awareness and also provide cancer screening and early detection services. Yeah, Lynn, you asked a question, why is it that by the time patients with breast cancer come to us, it's already late? I think I will request that all our viewers can allow us go through the different phases so that we actually understand pretty well why patients with cancer come late for cancer treatment.
Right.
I want to start by painting a picture for everybody about the burden of breast cancer. In 2018, there were 2,088,849 patients with breast cancer in the whole world. These were new patients diagnosed with breast cancer in 2018. 2,088,849. And that made 11.6% of all cancer cases in the world. And I also want you to note that breast cancer is number 2 in the world, just after lung cancer, which also accounted for 11.6%, but lung cancer was more, just in hundreds of numbers of the cancer patients. In Uganda, maybe I should also tell you that people who died of breast cancer in the world in 2018 were 626,679. And that made 6.6% of all cancer deaths. What I'm trying to highlight is that breast cancer is a big problem. There are many people who are suffering from it, and there are also many people who are dying of it. But I also want to emphasize that it accounts for 11.6% of cancers in the world, but accounts for 6.6% of deaths due to cancer in the world. And this emphasizes the fact that breast cancer is actually a treatable cancer and it's a curable cancer. So I want all our viewers to understand that breast cancer is actually treatable and it can be cured. And there are many breast cancer survivors in this country. In Uganda in 2018, there were 2,318 patients who suffered from breast cancer. 2,318 in 2018. And I also want to quickly tell you how many patients we saw at Uganda Cancer Institute last year, 2019. We saw 515 patients with breast cancer. These were new patients. And then we lost 26 patients with breast cancer in 2019. And we also received 37 men with breast cancer. I think Chris hinted on the fact that breast cancer is not a cancer for only women. Also men suffer from breast cancer.
And I think, Doctor, most people didn't know that.
And I think if you didn't know this, then now you should actually pay me for teaching you.
Yes, indeed.
Yeah, but you should know that all of us men are at risk of suffering from breast cancer. And when we tell people to be cautious about their breasts, men are inclusive. No man should think they cannot suffer from breast cancer. But I also want to emphasize again that breast cancer is a treatable cancer. It can be treated, it can be cured. Now, why is it that people come late when they come for treatment, when they have breast cancer? Now, I want to say that all cancers in general, at the start, there is no pain. Cancers do not cause pain at the beginning. And this is important to know. When somebody has malaria, they will have headache, they will have fever, they will have joint pains, they will lose appetite. Not true with cancer.
Right.
When somebody has cancer in their body, they will be fine, but the cancer is growing. By the time they feel pain or get symptoms or feel sick, the cancer is already advanced. And Lynn, this is the reason why many Ugandans come to hospital when it's late, because in Uganda the practice of seeking for health care services when somebody is well is not common practice.
Absolutely.
And so when it comes to cancer, if you're to wait for the symptoms, you are always going to present.
But how am I going to know I'm fine? How am I going to know I have cancer?
Yes, excellent. And that's why, we are very happy to be talking to you about these facts so that we can all begin seeking for health care, for checkup when we are not sick.
Right.
So, and before that, I want to take us through the risk factors for breast cancer. Because, if you're listening and you're hearing these numbers, you're wondering, how can I know I am at risk of suffering from breast cancer? So number one, breast cancer is a cancer that runs in families.
Okay.
There is a genetic predisposition to developing breast cancer. And so we usually tell people that if you have had somebody suffer from breast cancer in your family, know that you are at a high risk. It doesn't mean that the rest are not at risk. Everyone is at risk, like I already mentioned, including men. But for those who have had breast cancer in their families, their risk is higher. there's a gene that is responsible for breast cancer, BRCA gene, BRCA gene, that actually can be tested for and detected in individuals. But we don't do that, screening for that gene in this country yet. So that's number one. Number two, it also puts you at a high risk if you're a woman and you delay your first pregnancy up to the age of 40.
That is scary, doctor.
Yeah, it's scary, especially in these times where, career and many other things take precedence to starting a family. But everyone must understand that it increases one's risk to delay their first pregnancy. It also increases one's risk if they do not breastfeed their babies. So breastfeeding reduces the risk for breast cancer, and not breastfeeding increases the risk for breast cancer. So we've mentioned three things: family history of breast cancer, delayed first pregnancy up to the age of 40. We talked about breastfeeding, not breastfeeding as a risk factor. Then also we have hormonal therapy. Women who get in menopause and still take hormones to keep active in their menstrual ages, to keep menstruating or to keep feeling young, that increases the risk for breast cancer as well.
Okay.
Now, if you're listening and you're, from here, Uganda, you're like, how many Ugandans do
I know.
that, So I also want to mention that, the risk for breast cancer, many times there's nothing we can do about it. Everyone is at risk, and that underlying risk is there, standard.
Okay.
Yeah?
Okay.
So that's why we need to make sure we involve ourselves in breast cancer screening, breast cancer awareness, and breast cancer early detection services. But I want to quickly mention also that minimal physical activity increases the risk for breast cancer.
Please elaborate on that.
So you need to be physically active. If your job is like mine, to sit down and see patients, you need to do exercise. Yeah? If you have opportunity to dig, do it with joy, because you will be doing a physical activity.
That's right.
Physical activity doesn't have to be jogging as a rule, but you can even take a walk to work. Take a walk from work. Take a walk to a neighbor's place. We emphasize the fact that everyone should be physically active, maybe jogging for at least 1 hour, 4 times a week, 4 days a week.
Okay.
And that can be a tall order on many Ugandan women, especially who live in Kampala.
Those of us
But
who
we
have
encourage
families.
people to be physically active.
Yes.
If you can take a walk, that will be very excellent. Yeah, but if you can't take a walk, take time and do jogging. You can jog in your compound, even in your sitting room. You can even, run in one spot, like I used to see Nelson Mandela when he was in prison. So that's one. Then number two is obesity also increases the risk to hypertension. So if you're blessed with, having a body weight, it's important you're physically fit.
It is a blessing in disguise.
Yes, so that you do not have excess fat.
Yes.
That later is converted into estrogen that puts you at risk of suffering from breast cancer.
All right.
I also want to emphasize that it has been discovered that alcohol is associated with breast cancer. The more alcohol you take, the greater the risk of suffering from breast cancer. I know I'm touching on something that is very dear to many people. No, now Lynn tells me she doesn't see the relationship. So I think you need to appreciate also that before a cell becomes a cancer cell, there is usually a genetic change, which is in the DNA of the cell. Now there are different things that can cause this change to happen. And alcohol is one of those. The way Chris talked about tobacco use, the way we know that tobacco use is a risk for over 20 cancers, because the poisons in tobacco can actually initiate a cancerous change in a cell.
Okay.
That's why many of these things are risk factors, and it's very hard from the surface to see the relationship. And that's the uniqueness about cancer, that for many risk factors, it's very, very difficult to see the relationship. It's not like a mosquito bite. injects malaria parasites in someone and they suffer from malaria. Not true with cancer. So I want to quickly again mention why patients come late. Because Lynn, that was your first question.
Yes, I'm worried. I think
so,
we don't have...
So I want to emphasize again that in this country, many people do not seek health services when they are not sick. And we want to advocate that it's good behavior, good practice, good discipline to go to a healthcare provider for checkup. You just go and say, measure my blood pressure, take my history and know my risks as a person. And for cancer, particularly for breast cancer, we encourage all women to examine their breasts at least once a month. This should be a week after day 1 of your menses.
Doctor, that one, we will need a thorough explanation because not everyone knows how to check their breast.
Yeah, I'm sure there must be a survivor here who can.
I think she will tell us later.
But examining your breasts every month, 1 week after your menses, and we count menses from day 1 when you begin menstruating.
Okay.
You thoroughly examine your breasts, pressing against the ribs, so that if there is any swelling in the breast, you're able to take it to a health worker to further examine it and find out whether it's cancer or not. But I want to give you this comfort that many swellings in the breasts are not cancer. But you and me can never know what is cancer until when it has been examined and confirmed.
Yes.
Number 2, all women when they reach the age of 40, we want them to at least come to us so that we can screen them for breast cancer. So we begin doing mammography, which is X-ray of the breast, looking for signs of breast cancer at the age of 40.
So it starts at 40?
Mammography starts at 40, but breast cancer screening starts at the earliest age a woman has a breast. Okay. I want to emphasize that.
Okay.
All we do is examine you with our hands, take your family history, and tell you what to do about your risks as far as breast cancer is concerned.
Is that checking the same as the men also do the same for the breast?
Yes, the men also should be checking their small breasts. And my brothers who are here, we have very tiny breasts. But we should make sure that there is nothing in that small breast. Because the 37 men I'm talking about that we treated last year at Uganda Cancer Institute, many of them come when this breast cancer is very advanced. Because there is no room for the cancer to progress. There is no significant breast tissue for the cancer to spread before it crosses to other parts of the body.
Okay.
And that's the reason why for men, breast cancer usually comes late. So all women should make sure they learn how to examine their breasts, and they should make sure when they reach the age of 40, they show up in the hospital for proper breast cancer screening. And all men should also learn how to examine their small breasts. And then I also want to emphasize, again, that many breast cancer women that we have treated have actually identified the swellings themselves.
Oh.
And come and say, doctor, I feel this swelling in my breast. What could it be?
So are they significant? Can I easily pick it out and say this is a tumor or this is a swelling? Is it so easy for me to feel it?
That's a very nice one, Lynn. So before you start examining your breast, you will not know how your breast is. I'm saying you are normal breast.
Yes, yes.
You will not know that my normal breast feels like this. But the moment you start examining it, then you begin to know that this is how my breast feels.
Okay.
So that if there is any change, you're able to detect it. But the people I'm talking about who have come, I can remember one of them, whose name I won't mention, who was doing exercise after jogging. And then when she was stretching, she saw something like a dimple on her breast. And then when she touched, she found a swelling. She, went to a doctor, and the doctor said, yes, there is a swelling. We need to confirm what it is. And the beauty about it is that she is a survivor of this cancer, I think, for over 15 years. And I attribute that survival to the fact that she was able to detect it early herself and present it for confirmation and early treatment.
Right.
So this is to emphasize that we all must be aware of the status of our breasts at all times. No one has an excuse because you always have your breast with you. You don't have a medical person with you all the time, but you always have your breast with you. And this refers to our whole body, you know, people who are listening to us and everyone who is viewing, that we should all check our bodies at all times. If there is any swelling anywhere on our body, we should take it to a health worker. If there is anything that is abnormal within our body, it could be, you know, you bleed easily when you brush your teeth nowadays.
Yes.
It could be, you know, you cough all the time nowadays. Or you have constipation when you're passing stool. You know, anything that is unusual, take it to a health worker. Because many times, some cancers, the early signs are not very specific and obvious for cancer. They are kind of, you know, a mixed picture. And probably at this point I should chip in this, that cancers in children can be confusing because their symptoms are general. They can be feverish, they lose milestones, they get swellings, they get pains, and unless you quickly seek for health care, the cancer will not be discovered early, especially when it's in a child. So, thank you very much.
All right, doctor, that is very insightful about breast cancer. And most of you who don't know how to check your breast for any swellings and anything that is unusual, start now, because we're going to show you. I'm sure she's going to just a little demonstration on how you should do that. But we could also try it out at home, because you just have to. It is in a certain way, you know, you check your breast in certain ways. So we are looking at how the burden of breast cancer has been in Uganda. Doctor, at what point, because they are saying that 80% of women present when they're already on stage 3, stage 4, and it's too late, it's really too late. Do we have some... apart from the Cancer Institute, do we have other, apart the referral hospitals, do they know how to manage? Do we have expertise there? Like, because most people eventually are referred to the Cancer Institute right here. And I keep getting worried. If everybody from Kabong, from where they want to have to come to the Cancer Institute, don't we have such a huge burden on us?
Thank you very much for that question, Lynn. So let me paint for you a picture of how I personally think the path of a cancer patient should be. Because, you know, this woman will feel a swelling from their home.
Yeah.
So my recommendation is go to the nearest healthcare provider or health unit. Now the health worker in that health unit will be able to assess you and tell you whether the swelling you feel has signs for cancer, and will be able to refer you to the right place. So in principle is, let's go to our nearest health unit or health worker for routine kind of checkup and asking questions and getting answers. That's one. Number two, cancer treatment is a multidisciplinary practice.
How do you mean?
What I mean is that to treat cancer, you need different cadres who are health workers. You need different specialties of health workers. So for instance, if it's breast cancer, you might need a surgeon to operate the breast tumor or the breast swelling. You will need a medical oncologist to you know, give the chemotherapy, the treatment with drugs. You will need a counselor, you know, to counsel this patient how to go through the treatment. At some point, you might need an occupational therapist if the person has survived and they need to go back to work. You need a rehabilitation, you know, person to think about an prosthetic breast and artificial breast for cosmesis. And if you ask cancer survivors, they will tell you they interface all these different cadre. And this is very, very difficult to have in a small clinic somewhere, let me, for the sake of an example, somewhere on Bombo Road.
Okay.
Yeah, that's why cancer treatment centers world over, you find there's one cancer treatment center serving a bigger geographical area, because you need to have all these facilities and personnel and resources in
one
place.
Yes.
But like I said, it doesn't mean that all the care has to start there. Care can always start where you live, your nearest health facility. And at this point, I should tell you that we trained health workers at the district level to provide cancer awareness, cancer screening, and cancer early detection services.
Are they free of charge?
Yes. Cancer awareness and screening services are free of charge if you go to a government health unit. When it comes to a private one, the charges are different usually, but at Uganda Cancer Institute, they are free of charge services. And even the healthcare workers we trained, they should be providing free of charge services. And as I said, these are across the country.
Right.
And we are continuing to train more. And we are putting in place regional cancer centers. We have a regional cancer center at Mbarara Regional Referral Hospital that provides care to over 4,000 patients as I speak. That has been in operation for quite a number of years, probably like 4 or 5. And it has 21 beds. It runs outpatient clinics. It's a fully fledged unit in the Mbarara Regional Referral Hospital. We have a regional cancer center at Arua Regional Referral Hospital. As I speak, the renovation of the building is almost complete, and we'll be providing cancer services there as well.
Okay.
We already have land in Omoro district, which used to be part of Gulu. We are going to construct a regional cancer center for northern Uganda there. I think the government already has money and construction will start soon. And we also have plans of starting a regional cancer center at Mbare. I think we're already discussing acquiring land. So we want to make sure that these services are closer to the people. And I must mention that we have a community cancer center also in Mayuge at Uganda Health Center 4 with our staff there all the time.
All right.
So, Lynn, what I'm saying is that we are trying to make sure these services are closer to the people.
That's right.
Yes.
That's very, very important. That's very key indeed. And we like the strides that you're taking there.
Thank
you. Before I can ask Dr. Noleb again about the National Cancer Control Policy Plan, I will first speak to Dr. Ebusu Paul. Dr. Ebusu Paul is the ED Uganda Cancer Society. Now, I would want him to break down what has been happening between breast cancer patients and COVID-19. We are in unprecedented times, Dr. Paul, and we have seen that COVID-19 poses a great threat on non-communicable diseases, of which breast cancer is among. Now, how has it been? What is going on? How are we managing? What do you have to say?
Thank you so much, Lynn. I want to emphasize the fact that COVID-19 definitely, just like all other scenarios in society, has posed a lot of challenges. And so access to care services has been a huge problem. Of course, over time, we have tried to alleviate some of these challenges, but indeed they remain existent. But also I must emphasize that, COVID only came to re-highlight, if I may use that word, existing challenges. So it is not like these challenges never existed. And so when COVID came, the challenges appeared. No, that's not the case.
They've been there.
The challenges have been there. COVID-19 came and just made these challenges much clearer. So when we are talking about challenges in access to care, we are talking about basics, including things like transportation. When the lockdown was there, it's still there. Movement, if you remember from the very first times of the lockdown,
yes.
Movement was curtailed.
True.
You have patients who need to come to Cancer Institute, to Dr. Noleb and the team, they cannot. Accessing RDC letters or what, you remember that time,
yes,
was also a problem. So, We actually had a field visit, the Uganda Cancer Society team in Busoga, to visit patients and ask them what the experiences were. And indeed, these were very clear. Moving from Jinja here, Busoga, to Kampala here, became very difficult than ever before. And yet it was already difficult before. Are you seeing what I'm trying to say? Yes. It was compounding problems that were already existent and still compounding. So there is definitely a lot of need for society to come together to see how we can address these issues. You will discover that we talked about issues of feeling like you are part of society. You know, after surgery for breast cancer,
yes,
most of the times you find that they have removed one breast, maybe, not both. And now you get that feeling of imbalance, accessing that type of support service to make you feel whole again within society, as you're going through your treatment or as you're trying to reintegrate into society. Those are very key things. And for us as Cancer Society, we provide these services. And when patients come, I can assure you can see their faces.
That's true.
When you give a breast cancer patient a prosthesis, an artificial breast, and she puts on and she feels balanced,
it's life-changing.
It is extremely life-changing. So there is a need, and some of these things society doesn't need to wait for government or any other person.
Yes.
We can do these things together ourselves. We can be sure that the numbers Dr. Noleb has been giving us here of breast cancer patients who come to Cancer Institute, whom we can assume are the numbers for Uganda, all of them can actually access these services.
Okay.
What does it take to have these processes? It's not a lot of money. We have just not put our priorities right to support.
Okay. No.
So the need for support services is very key. The challenges have been existing. COVID has only compounded on them.
Dr. Paul,
yes.
You mentioned that access to of course, support and medication and
yes.
and that has become challenging because of COVID. But also, I would imagine consultations between patients with breast cancer and oncologists has equally been hard.
Of course.
Yes.
Of course. If you cannot come to the doctor, how will you consult?
Where then does that leave patients?
Yes. So, I mean, that leaves patients in definitely a very challenging time, because cancer requires what we call consistency in treatment.
And it's also costly.
Very costly. Adherence is very key. And one of the challenges is, of course, the cost of medicines. We know that government has got a policy that services are free, isn't it? That one we are aware.
Yeah.
And we want to appreciate
Dr. Noleb has mentioned that.
We want to appreciate and thank government for that. That is okay. But also we are very much aware that indeed this is not the case actually when patients come to hospital. Dr. Noleb and the team will always have challenges in terms of stockouts. That one is a fact. And so when this happens, which actually does happen quite often, patients have to seek alternatives in the private sector. The pharmacies you're seeing around here, from Wandege all over Mulago, these are some of the issues we're talking about. And the cost of medicine for cancer is very high. And it's not easy. When lockdown is there and then we are seeing that sources of earning are actually affected. But the costs of out-of-pocket costs have not changed. They have only gone up for cancer patients. So how do we come in? You see what I'm trying to say?
Yes.
So there is a need for the Ugandan population to become realistic. And these are things that we need to do together. We don't need to wait for somebody from outside the country to come and help us, or government only. We need to work with government.
Yes.
I think as society, we can work together. You understand what I'm trying? We can work together to solve some of these issues. Not all of them. Of course, government plays a key role. But we must work together to solve some of these issues because they are solvable. Yeah?
Okay.
If we sit back and say, then it is ourselves and the society, because you see, the cancer patients don't come from anywhere else. They come from us. From our families. They are our sisters, they are our brothers. It is ourselves actually who are patients. You get what I'm trying to say?
Yeah.
And we can help each other and help ourselves. So I think for me, the call here is how can we work together as a society to actually help cancer patients have a fair experience.
Do we actually have the authority? Do we have the moral support? Do we have that it takes for us to actually support cancer patients or those at risk?
It's a nice question. Do we have? My question is, do we not have? I think the counter question answers this issue. Ugandans actually have come together for very charitable causes.
Oh, yes, yes.
And we are known to be charitable, in as much as it is still a growing culture. But indeed, we have demonstrated over time. I think what is lacking is what we call guided direction.
And who should be guiding us?
I think the guidance needs to come from within ourselves. You get what I'm trying to say? The appreciation of the need. And now we're trying to display the need here. Now we know that there is a need and we can do something. You see, doing something begins from the individual. You can do something, I can do something. All of us as a group, as a society, as a country can do something. And once we appreciate that, then we will reach a level where we begin to ask ourselves, what can we do? Which is the question you have asked.
Right.
And I think that is the level where we need to reach to begin to actually make a difference in terms of supportive services. Without supportive services, care is incomplete in as far as cancer care is concerned. Dr. Noleb talked about psychosocial support. Dr. Noleb, rehabilitation services. All these things are very necessary. When we talk about the challenges cancer patients are going through, the trauma, the stigma, and all of these things, we can provide supportive services to ensure that patients actually have good experience. Navigation alone. Do you know that this hill is very complex? This hill you see
the hill to the
where
Cancer
Dr. Noleb
Institute.
sits, it is a very complex hill. And when you're told that you're now at Mulago, people begin to worry.
Of course.
So it's a very complex hill. And we can have programs that can provide better experience of patients going through treatment. What we call navigation programs, for example.
Okay.
To help patients. And navigation, for example, does not mean only moving a patient from where the doctor is to where the lab is. No. It begins from clinical navigation. Dr. Noleb and the team don't have all the time to explain all these things because they are trying to help the next patient who is on the line. So they don't have a lot of time because the patient lines are long, which is really understandable. But then we need to have navigators who then support the work Dr. Noleb is doing, because the patients should be at the center of care.
Yes.
And so the patient should be able to know, what exactly am I suffering from? What is the stage? What are the issues relating to my care? So clinical navigation is the first stage of helping a patient to go through a good experience in terms of care, where we have trained maybe nurses or something who can then go through the diagnosis Dr. Noleb and the team have written and say, now your case is like this, like this, like this, and these are the issues surrounding
And
it.
most of them are taken advantage of.
Exactly. And now you have that, and then you have other basic navigation processes.
Yes.
Where is the lab? Where is the... Are you understanding what I'm trying to say? Patients get lost. Even just accessing records. You can come to Cancer Institute and you take almost a whole day. Patient is just seeking for a record from the file, and it's not coming through. So I think that there's a lot that can be improved within the facility level, but also at national level. You hinted issues of policy. Where is the national cancer policy in this country? I don't see it. Policy provides what we call a supportive environment. In Uganda, we do not have a policy on cancer.
We survive.
We just survive, like you've said. Those are your words. I will keep that to yourself. We survive.
Yes.
We don't have a national cancer control plan. Dr. Noleb will talk about those things. But I am very certain we don't have one. So we don't have a policy, we don't have a plan. Neither, of course, do we have an act, for example, as a law. The law provides the authority to the policy.
What have you as the civil
Exactly.
society done?
This is exactly what I'm trying to say. What we are doing, like I'm doing now, is to agitate and to seek that, I mean, to put government to task to put these things in place. Dr. Nala will talk about these things. Okay. But I'm trying to bring this voice out. We need a national cancer policy. We need, as a country, a national cancer control plan to provide a supportive environment for care across the continuum of cancer control, from prevention to end-of-life care,
right,
to palliative care. Talk about it. The absence of a supportive environment puts us at a disadvantage. That is for sure. Including issues of resource allocation. You understand?
Yes.
Because when they're putting these budgets out and all of those things, they follow some of these issues. Yes.
Now they're just...
I mean, I don't know. They will tell us how this is being done.
All right.
But resource allocation in the country comes alongside prioritization. And prioritization is determined by policy.
All right.
Because it has been put on paper and government has endorsed, cabinet has signed and said this is now national what? National policy. We have a policy on malaria. Do you know that?
Yes, we do.
We have a policy on HIV/AIDS. Do you know that? Where is the national cancer policy? I've not seen. I'm sorry.
Maybe it is in the works.
You ask government.
Yes.
And so I know that it is definitely priority of government.
Yes.
What I'm trying to say here is that I think we need to move slightly faster. I'm not saying that government is not thinking about it.
Yes.
I'm very much aware that government is thinking about it and government is doing something. Dr. Noel will explain those things.
Okay.
We will tell you details.
Okay.
I'm very much aware about that. I'm only trying to say that we need to slightly move faster because the situation is not the best.
Dr. Paul,
yes.
Do you think with that, if that plan or that policy was in existence, things would have been much better with COVID-19, especially in regard to breast cancer?
So, again, these are you see, when we have policy, it provides for a supportive environment.
That's right.
And it is really very good that if we build national policy that has components on how we deal with emerging issues, emergencies, then you find that we have got laid strategies that then provide for how do we handle scenarios like this.
Right.
Indeed, if we had the policy that had that type of deliberation within itself,
yes,
then it would provide us a better basis to ensure that within COVID-19 emergency, actually cancer care is integrated in the response. And this is one of the things we have been urging from the time lockdown started, that we need to integrate cancer care within the national response of COVID-19. You get what I'm trying to say? Because it can be integrated. Some countries have done it.
Yes.
You get what I'm trying to say?
Yes.
So why can't we do it? We can do it. So if we have policy and plans that are sensitive to emerging issues, then we would have had strategy already laid down and say, if such and such emergency occurs, an epidemic, and I mean a pandemic like this, then we should do X, Y, Z to ensure that care does not get disrupted in totality.
That's right.
Yes. But I must commend really the work Cancer Institute has done. They have really tried to do. And in fact, you realize that Cancer Institute has been a model.
All right.
Almost for the region. But I'm saying that policy remains key. Policy provides for a supportive environment. And I want to thank the efforts that government is trying to do. I'm only urging that can we make it faster slightly.
Okay.
That's it.
Okay, we can still do the same together as we beat breast cancer, as we beat all sorts of cancers. But most importantly, being October, the breast cancer month, it is very important for us to work together and to make sure that we help each other in managing breast cancer. I want to thank everybody that made time for this, and to you, the viewers, a very wonderful time as we walk around. Go and get checked.